Salmonellosis is an enteric disease caused by the bacterium Salmonella, of which there are many types. This bacteria is found in the gastrointestinal tract of warm and cold-blooded animals and is shed in the feces. Salmonella bacteria can be found worldwide, but seems to be most common where intensive animal husbandry is practiced. Wild animals can also serve as a reservoir for Salmonella. Salmonellosis is zoonotic and is usually transmitted to humans by eating foods contaminated with small amounts of feces. However, people can also become infected through close contact with livestock and other animals that can pass Salmonella in their feces. This means that veterinarians, farmers, and others who are in close contact with animals as part of their occupation or recreation may be at greater risk of being exposed to Salmonella in this way.
Salmonella are readily spread through food and water contaminated with feces from an animal or person shedding the organism. Handling animals with diarrhea without appropriate sanitary and disinfection procedures increases the risk of acquiring salmonellosis. In addition, some animals can be reservoirs of Salmonella and can shed the bacteria in their feces without showing any clinical signs of disease. Most people infected with Salmonella develop diarrhea, fever, and abdominal cramps 12 to 72 hours after they are exposed to the bacteria. The illness usually lasts 4 to 7 days, and most people recover without treatment. However, in some, the diarrhea may be so severe that the patient needs to be hospitalized. Illness is likely to be more severe in children under 5 years of age, older adults, and people with weak immune systems.
It's important to remember that if you develop symptoms that could be due to a zoonotic disease, you tell your doctor about any animal contact you have had, since this might be helpful in figuring out the cause of your illness.
Most horses do not show clinical signs when infected with Salmonella, so they may be shedding and you will not know it. If they do get sick, they will typically have the same signs as people, such as diarrhea, fever, and abdominal cramping, which in horses is also described as colic. Stressed horses are more likely to shed Salmonella than unstressed horses. Examples of stressful situations include long-distance transportation, a horse show, especially if a horse is new to the show circuit or has not yet become used to the environment, pregnancy, and illness unrelated to Salmonella. Infected horses typically shed Salmonella intermittently. Therefore, your veterinarian may ask you to submit more than one fecal sample for testing to try to determine if Salmonella is the cause of a horse's illness.